Good morning, everyone. Welcome to the Healthcare Support Workers Mental Health webinar this morning. My name is Amy. I am the Regional Account Lead for the Southwest on an NHS team here at Indeed, who have partnered with the Southwest NHS team to conduct this webinar this morning. A couple of housekeeping just before we start. Everyone who is attending today will not be able to be seen and be heard. So if you do have any questions, please pop them in the Q&A box below. Only the speakers today will actually be able to be seen and be heard, but we would love to hear all your questions. So please do pop them in the box below and we will go through them at the end. In terms of today's agenda, we're going to start with an introduction into mental health within the NHS. Followed by Devon Partnership Trust will actually be speaking to us from a healthcare support worker perspective and the day-to-day role. Then a little bit about the sort of application process, pastoral care, and we'll be hearing from the education team in terms of what to expect going forward. And finally, some application and interview tips from Helen Edmonds on the Southwest team. We will finish today with a Q&A, so we do look forward to hearing all the questions you might have. To begin then, we will be starting with a video from Emma Wadey, who is the Head of Mental Health Nursing, NHS England and Improvement. So she has recorded this little video ahead of the webinar to share with us today. So I'll get that up now.
Hello, welcome. My name's Emma Wadey and I'm the Head of Mental Health Nursing for NHS England and Improvement. Firstly, I would like to say thank you so much for considering a career in mental health and giving up your time today to hear more about the fantastic career that awaits you in mental health settings across England. I've been a mental health nurse now for over 20 years, but I started my career just as you are considering starting yours as a healthcare support worker. It was the best decision I ever made. I think all those years ago when I stepped first into my first role, I had no idea of the impact I was going to make, but also the opportunities that would come my way. Mental health settings really are diverse. Across my career, I've had the absolute pleasure to work across community settings, in hospital, in prisons, in acute sector, and also in an ambulance service. So the world really is your oyster should you choose this career. It's also one of the few careers where you can actually make a difference to people from cradle to grave. We have services supporting new mums in perinatal mental health, as well as supporting those at the end of their life, ensuring that they have a good death where they're supported, they're cared for, they're not in pain, and we look after their families. Whatever your background, whatever your skills, whatever your ambition, mental health is the place for you. We really value diversity of thought, diversity of background, and diversity of skills, as you're able to use everything that you bring in your whole life to work with you, to enable you to engage with really who are the most vulnerable in our society. There is no health without mental health, and if anything, the last year has really shown us the importance and significance of that. And by starting a career as a healthcare support worker within a mental health setting, you really are going to be making a difference, not just to one person's life, but that's to their whole family and their whole community. So thank you for taking the time to find out more today. I really think this is the career for you. So open your minds, listen hard, and ask as many questions as you can think of. Thank you.
So now we will hear from Devon Partnership Trust from two healthcare support workers who are currently in post, Jez Bowers and Kaylee Coles.
Okay.
Good morning. My name is Jez. I'm a healthcare support worker. I've been employed by DPT for almost 14 years now. I'm based over at Langdon Hospital in Dawlish. We're the hub for secure forensic services. Forensic being generally we deal with service users or patients who have had dealings with the legal system. I thoroughly enjoyed my time being a support worker. My background before coming into this was sort of flittering around from job to job, not really knowing my place. I've done warehouse work, catering. My mum is a mental health nurse, and she asked me if I'd be interested in doing something like this, and I've never looked back really. I think in terms of the rewards for the work that we do it's second to none. There's no other job in the world where you can really make a difference in someone's life. And if you're a people person, this is definitely the job for you. I'll take you through sort of a day in the life of a support worker here at Langdon. So we work shift work, so we do earlies, lates and long days. We'd come in, and firstly you would have a handover, a detailed handover, to let you know about any new risks on the ward. And then the nurse in charge of the shift would then delegate roles for you as a support worker. So within the support work role here at Langdon, there are a couple of different roles that you'll be expected to take on each day. So there's the housekeeping role. So you would be in charge of making sure the patients are fed, beds are made up, that sort of thing. There is a security role, which is fairly important. So you'd be responsible for making sure that the place is safe on that particular shift, making sure that sharps are accounted for, and making sure that the building itself is safe. So there's various checks that you would have to complete and sign off that you've done that. One thing that I will say is, from a new starter's perspective, when you come into this job, someone like myself, who's been here quite a long time, you could call me a seasoned support worker, would take on a sort of buddy role, if you like. So you would shadow us, and we would take you through the roles and make sure that you feel confident and competent in what you're doing. Usually when you start, you would be supernumerary, which means that you would be outside of the normal numbers that we need to keep to make the wards safe. So there wouldn't be any pressure for you to just dive right into the deep end. You'll always have that support from the staff on the ward. I've always felt supported. I've got a young family, and I've always felt really supported by DPT. It hasn't really stopped me from coming to work. They really do look after you. There are a lot of opportunities for support workers nowadays to progress. So if that's something that you're looking to do, maybe you wanted to be a mental health nurse, support work is definitely a good option for you to get some experience. And a shining example of that would be Kaylee, who has taken those steps and has progressed her career since being a support worker. We actually started together all those years ago. Yeah. And I will hand you over to her now.
Hi, so I'm Kaylee, and I'm actually an assistant practitioner on the ward, which means, so basically when you're employed as a support worker or healthcare assistant, you're a band 3. I'm actually a band 4. I've done a foundation degree, and a registered nurse is actually a band 5. So I'm a little bit in between. I started my role here, say nearly 14 years ago, actually with Jez. We started at the same time. The reason I come into this, my background was I worked as a lab technician and I worked for the Environment Agency. And I used to drive past Langdon every day, and I'd heard stories about what it was. And I was really interested in mental health and also in the forensic side of it. So I looked for jobs, and there was a job in the reception, so I applied for that, and I got it, and I realised quite quickly that it wasn't for me, and I wanted to be on the ward working with the patients. So I applied for a job as a support worker, now a healthcare assistant, and I got a job on the admissions ward down on the old unit, the Butler Clinic, which is a medium secure unit. That is no longer. We now at Langdon have a brand new medium secure unit with which has 4 wards on. Also, if you're unaware of the Langdon site, there is 2 low secure wards and 1 open ward. So low secure means there's less restrictions. They still have a fence around it, but the patients have a lot more freedom to come and go. The open ward is there's no fence around it and it's open. Just for a little bit of an explanation on that. But yeah, so I was a support worker for many years because years ago there wasn't much progression for healthcare assistant support workers. There was not many opportunities, but the trust have come to realise that actually these people, you know, that have been doing this job for a while or not for a while, it's good for them to progress and it gives them something to look forward to. So I applied for the foundation degree, which was the assistant practitioner training program, and then I got an interview and found out I was actually pregnant, so I had to pull out. I then went on to apply again for the second time, and I got onto the foundation degree program, and which takes 2 years, and I managed to complete that with the support. I mean, you get a lot of support from DBT as you're going through it, even more so now because I was only the second cohort, so it was a new thing when I did it, and I think the trust have realised that it's quite difficult and that you need a lot of support, and now that support is in place, so it's an amazing opportunity for healthcare assistants. And then you can go on to do your nursing degree, which I'm currently in the process of looking into, and the trust do support you with that as well. But yeah, there's just amazing opportunities now compared to when we both first started, wasn't it? There was not really that much opportunity, but now there is so many different options and so many different routes, so many courses, so much training. Yeah, so it's a great opportunity to become a nursing assistant. And like me and Jez have been here for many years, and I mean that goes to show that it's a good place to work because you know, spending that much time here. And like Jez said, they're very supportive. I've gone on to have my own family since I've been here. You know, we both started off in our early 20s. We now both have families, and we've managed to work all the way through it. It's just a great opportunity. But yeah, I think that's
yeah, I think,
yeah.
You know, like I said, as a support worker, you're sort of the eyes and the ears of the ward. It's a very, very important role. You're going to be spending more time with the patient than anybody else on the ward, really. And that work that you do with them, however small or insignificant you might think it is, it could make that service user's day, whether it's something as small as having a cup of tea and a chat. That can really make a difference in someone's life. And I'll say it again, the rewards that you get from working within mental health services are just brilliant. It's what's kept me in the job for all these years.
Yeah, and a lot of the time here at Langdon, you might see the patients come in and they can be acutely unwell, and then they'll work their way down the wards, and then you see them progress into the community. So working here, you have that opportunity to see that, and it is amazing. And the rewards you get to see when you see them back out in the community, you know, living a great life, you know, and it's very rewarding. I also wanted to sort of speak about my role as an assistant practitioner. So because I'm in between, my role is to support the band 5, the nurse, so that they get the opportunity to deal with the medication and the nurse side of things. So basically my day-to-day role would be to run the shift and support the nurses in whatever way they need. Also, I will sort of go back in to do a nursing auxiliary role sometimes if the wards are short, you know, so it's you do a bit of everything. I'm a primary nurse, or not nurse, but a primary key worker for one patient on the ward. So I deal with all of his needs, all of his care plans, I attend all of his meetings. So the main difference between an assistant practitioner and a registered nurse is that the medication, I don't touch the medication or deal with any of the medication, but I generally do all the other stuff that is on the ward. Yeah, but it's just a great opportunity. And you've also got the opportunity to move on and become a registered nurse if that's what you wish, or you can stay as a band 4, or you can stay as a nursing auxiliary. All of the jobs are really rewarding.
Thank you so much, Kaylee and Jez. Thank you. It's really good to hear about all the progression opportunities and also the day-to-day role as well. And I really like that term that you're the eyes and the ears of the ward. I think there's nothing more true than that. I'm going to pass you over now to Gail. Gail Still, who is the recruitment team manager at DPT.
Thanks, Amy, and thank you to Kaylee and Jez. As Amy's explained, I'm the recruitment manager for our forensic mental health service, which includes our inpatient service where Kaylee and Jez are, our prison mental health teams and our community services. I'm based at Langdon Hospital with Kaylee and Jez in Dawlish, and I just very briefly wanted to tell you and explain a little bit about our recruitment process and our induction and onboarding for our nursing assistants. Slightly different at Secure Services Directorate, because our healthcare support workers are actually called nursing assistants, so slightly different. I'm not going to go into too much detail about our recruitment process, because I know Helen a little bit later on is going to go in a little bit more detail about that. But some of you joining today will hopefully apply for one of our current nursing assistant positions, and you'll be taken to NHS Jobs and you'll fill in an application form. And within our Secure Services Directorate at Langdon Hospital, we will then take you through a pre-screen interview. It's quite a brief one. It will be with members of my team, recruitment. And then depending on how you get on with that, you'll then be invited back to a second and final interview with 2 nurses. If you're successful and you join us, we have a very in-depth induction and onboarding. It's had to be slightly tweaked because of COVID. Normally we'd be welcoming you to a nice hotel near our head office in Womford, where you'd meet the chief executive and other members of our team. So we've had to slightly tweak it, but we're really proud of what we have. So it's a 4-week induction and onboarding programme now for our nursing assistants. And week 1 starts with an introduction. You'll have your uniform, you'll have a nice little goodie bag and your badge, so you'll all be set up. You'll then join us in our beautiful library in our Junan Centre, which is, as Kaylee and Jez have explained, is where our medium secure unit is. We've just completely refurbished it, and it overlooks the site at Langdon, which is beautiful, and you can it overlooks the coast and the sea in Dawlish. It's fantastic. So you'll be based there for a week, and during that week you'll be doing some e-learning, I'm afraid, and you'll be covering some really key e-learning topics such as basic life skills, infection and prevention control, and food hygiene, as well as corporate induction. In addition to the e-learning that you'll need to do before you start on the ward, you'll also get the opportunity to meet some of our patients. And also their carers, and we feel this is really important from the get-go, because you can actually hear from our patients what's important to them, and what they need from staff and from you as a healthcare support worker. And also during the first week, you'll have some PPE instructions and how to use equipment and PPE. You'll have mask fitting. You'll also have, you'll meet our chaplains. Jez, I'm joined by Jez, my colleague, who does a fantastic job for DPT. And he's now part, and his team part of our induction programme. And that's really important, the pastoral care. And Jez will be talking about that. So that's week 1. Week 2, we then go on to a full week of PUMA training. So PUMA stands for Proactive Understanding and Management of Aggression, so PUMA. And PUMA is for anyone who is working in a mental health environment and on an inpatient unit. They're required to do PUMA training and also breakaway training. So PUMA is a range of skills to help manage, prevent and deal with violence and aggression from patients. But it also gives you a better understanding of why an individual would escalate towards verbal hostility or violence. So that's a week-long course, and it's really important. And then weeks 3 and 4, you're good to go. You, as Jez explained, you become supernumerary on the ward in week 3. And this is where you have your opportunity to get to know the patients and get to know your team and your role within that team, which is really important, and find your way around your ward. Thereafter, we will meet you regularly, and Jez, who I'm going to hand over to now as our chaplain, will talk about the role he and his team play in the pastoral care side of things, and we'll be following up on that. Thank you.
Thanks, Gail. Now we're going to pass over to Chaplain Jez Brown.
Hello, good morning. You may think that everyone has to be called Jez who has anything to do with the NHS in the Devon Partnership Trust. Good to be with you this morning. Our chaplaincy department was launched in 2019, and in the last 18 months we've come a long way. And part of our initial work has been to explain to staff that we are here for them and for you as much as we are for our patients and their carers. And we are here for people of all faiths and none. We have a lot of work to do in this generation in explaining to people that our role is beyond talking just about religious things and spiritual things, and that in fact pastoral care is at the very heart of what we offer to patients, carers and staff. So from day one, we will be here for you to support you alongside others in the trust that you work for. We exist because the 2015 NHS guidelines explained that there should be this level of care and support for our staff. And so we now routinely, myself or my colleagues, attend all localised staff inductions to offer to you a friendly face, we hope, and to explain that pastoral care is there for you. And you might think that pastoral care sounds like a very slippery kind of heading. What actually does it mean? What's the nitty-gritty behind this idea of pastoral care? I want to just run through very briefly some of the parts of pastoral care that we offer to you. First of all, we are a confidential listening ear. Sometimes you will find that you just want to talk to someone outside of your line managing situation with your supervisor or with family. You just want an independent listening ear, someone to bounce things off, because at times for all of us, life is difficult and situations arise that you just want to talk about and to share and to get help with. So we offer a very much a listening ear, and we can do that very briefly on the wards, because you're busy people, you can be busy on the ward, but we can arrange to see you out of work time in your own home if you'd like to, or in a cafe or a pub. Secondly, for some people coming into our services, we will offer cultural care, particularly if you've come from a different part of the UK, or if you've come from overseas. There'll be cultural questions that you'll have about how to fit in to the location where we're based. And so cultural care is becoming increasingly important as we find that healthcare assistants, support workers are moving from different parts of the country, or indeed from different parts of the world. We'll do our best to help you overcome some of those kind of cultural hurdles that you might first experience when you come into our services. And of course, as part of that is to deal with stress. People say that to move house or move job is one of the most stressful things you can do. And it's true. As a minister, I've done that many times in my life. But particularly when you start a new job, if you've come from a new country, this is a new country for you, you're going to have stresses to do with maybe dealing with a new job, a promotion, family issues around schools and travel and finding your way around. And again, part of our care for you is to help you take small steps forward in what can be quite a stressful time. Also, we're there for you in terms of if you have relationship difficulties at home or in the workplace, or if you have any work-based problems, we can help to signpost you towards those who can change things for you, wherever they are within HR or within line management. We're there for when life gets tough for you, and maybe you suffer from low self-esteem or low self-worth. And part of our role is to help to engender hope and a recognition of your absolute qualities and unique abilities that you have. So often we find that in providing this service, it's the first time that someone would have thought about sharing how they're feeling or problems that they're facing. So we are there for you. I could give you many examples, but my time is down to 2 seconds. And just to say to you that we are there, and hopefully from day one, you'll find a friendly-faced chaplain who can be there to help you and to support you. Really want to encourage you to get involved in this aspect of work.
Thank you so much, Jez. We're going to pass over now to Belinda Orchard. And Belinda is the practice educator at Devon Partnership Trust, sitting on the practice education team.
Yes, hello everyone. Amy will shortly bring up a slide so you can see pictorially what we offer in the team. As Kaylee has already said, there is an improved offer of training for people in the trust. So this is largely done now through apprenticeships. It used to be seconded degrees when you would be a full-time student, but the trust would support you and pay you a small salary. But now it's increasingly apprenticeships. So in an apprenticeship, you stay in your role and you have time off for studying or to be on placement once you get into the higher degrees. So depending how you come into the trust, you may already have A-levels, or you've done an access course, or you may not have done, because a lot of people who come into care work may not have taken an academic route. And if you haven't, but you're thinking, actually, I'd really like to progress and go on to learn more about my role as a nursing assistant, or perhaps I'd like to be a nurse in the future, you will need your level 3 qualification. So we offer the senior support worker apprenticeship for that. And it's an 18-month course, and you probably do it with a group of other people from the trust, and we would support you from the practice education team as well to do that. If you come in to the trust and you've not had any care experience at all, you would need to do the care certificate. It's a national requirement, and you'll be supported to do that on the ward. So once you've done that, if you wanted to, you can do the level 3 apprenticeship. Alongside that, if you haven't got your maths and English, you can do your maths and English alongside the apprenticeship. And if, Amy, if you bring up the next section of the slide, you'll be able to see where you can take these qualifications. So there's a range of nursing apprenticeships, and Kaylee said she did the assistant practitioner role, which, as she said, is it's a foundation degree. The nursing associate role is also a foundation degree, and either of those can lead you to the registered nurse degree, or you can go straight into the registered nurse degree if you have the right qualifications to begin with. There is an application process for all these, but we would support you through that. If you were interested, you can come and talk to us and we would help you get yourself ready to apply for those. As well as the nursing qualifications, we also offer apprenticeships for social work, occupational therapy, and psychological well-being. And we have a range of other non-clinical apprenticeships as well for people who want to go down that route. So some people come in and they know where they're headed. They might say, I want to be an occupational therapist. So we would help them track through the route. You would be best placed to do the assistant practitioner role because it does have the opportunity to do an occupational therapy module. Or you could do the nursing associate role if you wanted to go on to be a registered nurse. Next slide, Amy. So as Kaylee also said, and it's really good to hear that she's noticed that we do try to support our apprentices throughout their courses. So in the practice education team, we coordinate the apprenticeships and we also support you. Amy, if you could bring up all the elements on the daisy, you can see how we support people. So we work alongside your manager for the level 3 apprenticeship. We work alongside your manager to identify who's ready to do this course. You can tell us you're ready and we will support you, but we'll check with your manager that they're able to release you for that 1 day a week. The level 3 is a really good course to do if you're a nursing assistant because it teaches you about your role, about the underlying knowledge and values and behaviours and skills that you need to do that role. And as you can see, we also have advice and guidance for people who have questions about where they want to go. And we do that either via email, one-to-one support, or we have monthly career development sessions in the trust. So people can come along on Teams now, used to be in person, and there you can hear all about how apprenticeships work and you have an opportunity to ask us questions and we'll answer your individual queries about it. So throughout your apprenticeship, we offer you support as well. So we meet with people who are on the course, either in a group supervision, and that's generally about once every 2 to 4 weeks, or we do one-to-one support as well. We also work in partnership with the colleges and universities, so we keep in close contact with them. So we find out if you're having any difficulties, how we would support you, and who are the people to talk to. And when we're talking to you, as Jez has said, we will signpost you to different services. You know, people come to us who may not have studied for 10 years, 20 years, and are quite anxious about that. We would make sure with your college or university that you have those study skills that you need. If you come and you're finding that life is quite difficult for you, we can signpost you to wellbeing services. We can also signpost you to learning support. If you have additional needs, you might need a bit of extra time and support to do your apprenticeship. And we also have, if you feel you're not quite ready to do an apprenticeship, we have with our local college, we offer you career and study preparation where you can do your functional skills and you can do some personal development work to get you ready to take that next step. So I really welcome any questions and thank you very much.
Now I'll hand over to Helen Edmonds. Helen is the Head of Workforce and OD for the Southwest region.
Thanks, Amy. So I think the first thing before I start talking about some of the application process and some interview tips possibly is just, I don't know we'll pick up questions later, Amy, but I just want to clarify for those listening in on the webinar, the vacancies, as much as we've got Devon who have kindly given up lots of time and supporting us and wanting to talk through their processes, and we've heard from our healthcare support workers, is the roles that we've got are across the Southwest. So we do have mental health trusts in different sites, as well as Devon, we've got Dorset site, Somerset, Cornwall, Gloucestershire, and Avon and Wiltshire partnership. So please do rest assured there are vacancies across all of those. And in terms of the route from here, after the webinar today, there are a number of things that will happen. You can, on the area that you live in, you'll be able to click on the link and that will take you through to the vacancies that are available at that particular mental health trusts that are advertising in your area. But also what Indeed will do is we'll send out the links as well to those of you that are registered with those email addresses. So you'll get copies of that to your email address, and again, can click into those links so that you're applying to the area that you live within. When you click into those links, it will take you through to our NHS Jobs application page. So on the NHS Jobs site, when you go through the application form, the first thing I'm going to say is it's not attaching a CV. So just dispelling this about what it looks like. It is an application form that's going to ask you for some of your information. So your normal data that you'd expect, name, address, etc. Some qualification information, job history, where there's a job history, please put that through. And other experience, if you are new into employment and coming out of a education setting, again, it's really helpful if you put in areas where you've done part-time work or volunteering. And then you'll get to a section about supporting information. And in that supporting information, what the organisations are really interested in hearing from you about is what skills you've got that can be transferable into those healthcare support worker roles. As we've heard already from Kaylee and Jez, if you don't have to have had a background in care to still have transferable skills that you can bring forward. The organisations, as much as they're going to be looking in terms of what skills you bring, they're also very values-based. So it's really important that my top tip would be to actually have a look at the organisation itself. You can find that through just Googling the hospital trust and having a look at what their values are. All of our hospital trusts put those values on normally their front page, on their home page. And they're nothing that you wouldn't expect, but it's all very much about wanting to see how your skills transpose into the values that people were looking for in the organisation about caring for other people and looking after our patients, and also looking after each other. So that's really important to just think about what skills you've got that you can bring forward to make them transferable. When we look at application forms, there is on that supporting information, it looks like there's, I think it's a lot of words. I think it's now 1,500 words that you can talk about, and it's really helpful. Not saying you have to fill all of those words, but it's really helpful if you write as much as you can rather than just a single paragraph. It's helpful to write a little bit more, especially giving us some evidence of why you're saying it. So I'll give you an example. If you think that you're a great communicator, if you just said, I'm a great communicator, that's not giving us any information that tells us why. So just tell us why you think you're a great communicator and give us an example of where you have done something that can demonstrate those skills. So those examples are what we would call competency based. So it's the reason we do that is if you talk to us about an evidence, an example of what you've done, it's the best judgment that we've got of how you'll behave again in the future. So behaviour of where you've dealt with a situation previously will tell us about what we think you might do moving forward. So those giving evidence in that application form is great as well. And then, as we've heard already, in terms of the process, that will vary depending on the trust that you're applying for. But generally speaking, the application form gets submitted at the end of it when you've checked everything, and it's really clear as you go through, you'll see that you'll get a tick to say you've completed each section that is needed. When you've put that through, you've put your references on there and you've submitted, it will come through into the recruitment teams. And when they've hit the closing date for those job applications, they will go through and look through who they want to bring in to interview. Some of those organisations, as we heard, will do a sort of pre-screening interview, which is done normally through Teams, Microsoft Teams, or over the phone if that's not possible. That's normally done by the recruitment team, and they'll just go through the application form, just check some of those details out with you, ask you some of the questions, just to make sure they've got all the information they need in that. And once you've got through that, if that stage is all okay and you've gone through that pre-screening process, it will then be put through to go to the panel interview. And that panel interview normally is a couple of nurses, sometimes again in different trusts supported by someone from the recruitment team, but at least you'll have a nurse on the panel as well, who again will be asking you questions, so those competency-based questions, asking you to give examples of where you can demonstrate the organisation's values, and probably asking you as well about what brings you into wanting to come into the role. So just, it's good to think about why you're coming into it. It's also good to think about the skills that you're going to bring, and perhaps also, whilst it may not be a question that they will mark necessarily, but it's also good to think about where you want to go. Is it that you're really comfortable staying in the role and just want to develop to be the best you can be in that role? thinking about longer term, there's a pathway for you and what that career pathway might look like. And then there's always an opportunity in those interviews to ask questions if you've got anything that you want to check out as well, because we want to make sure that people that come into these roles are coming in because they want to stay. You know, we really want you to come in and have a great experience, really embrace the role, really embrace everything that you're going to get out of it, because as I say, as we've already heard from Kaylee and Jez, it's super rewarding. You will get you know, so much from it, but we want you to come in knowing everything, that you've had all your questions answered and that you feel really comfortable with what you're doing. So I think things for me in terms of my top tips of that is preparing. So knowing, you know, the organisation you're going to and just checking them out on their website, understanding their values, knowing what they're all about if you don't already. Having your examples prepared in terms of giving the evidence of why you think you're going to do things. Completely understand you don't know the questions you're going to be asked, but if you've got a bit of a bank of examples you can give, then you can always draw on those examples in the interview. I think generally speaking, it's always really useful to think of an example where you have supported equality, diversity and inclusion, because certainly from an NHS perspective, that's really very, very important to us in terms of that people coming into us and working in our organisations have that ability to work with people from all different backgrounds, in both the colleagues and our patients, and deal with sort of health inequalities, and know that you think about where you might have done something to add value in that space, or an example of where you have worked somewhere to support equality, diversity and inclusion, either through a volunteer role or in your educational setting or in a work role. Just think about that, and that's normally a question that is always asked in an interview nowadays, because as I say, we value that so highly, and really working hard to make sure that all of our colleagues have that fair and equitable, fair and equitable treatment. So I think another top tip is if you bring those examples, I think my plea is please don't come in and tell us that that's treating everybody the same, because absolutely it isn't. It's all about valuing all our differences and treating everybody as individuals according to their needs, and so on. So I think that would probably be something to think about, and think how you might bring that into the interview. So I think, Amy, that's all for me. I think, you know, look at the organisations, look at the geography you're in, research the organisation, and then think about some examples. And then in the application form, you know, look at it, do what you can, fill out as much as you can. You'll get the tick boxes when it's all done. Double check it before you submit. Just reread it back to yourself to make sure that, you know, when you've written it and you've been typing into it, that sometimes it's good to just have a read back, or maybe get someone else just to read it for you, just to make sure that it makes sense. And then when it's submitted, obviously then you'll hear back from the organisations for the next stages. Thanks, Amy.
Thanks, Helen. So we have come to the final part of today's webinar, and it is the opportunity to ask any questions. So just to reiterate, if you do have any questions, pop them in the Q&A box below. Just something that I know Helen mentioned, and I know there's quite a few questions coming in about it. So today's webinar is about mental health, and specifically healthcare support worker roles within mental health. Devon Partnership kindly came on to speak about, you know, the way things work in their trust, how the role works, and in terms of onboarding. But they are obviously just one of the mental health trusts within the Southwest. So it is just to reiterate that a lot of you will have applied through Avon and Wiltshire, Cornwall Partnership and Dorset Healthcare. So don't worry, each of those trusts will have your details from when you signed up. So they will be sending you specific application links afterwards for that particular trust. If you do find, though, that some of the links that you're sent aren't roles that maybe aren't close enough to you or weren't exactly the location you were looking for, do try NHS Jobs directly, and you'll be able to actually filter through and see some of the roles there specific to other locations. So it was just to reiterate that. So I'll stop sharing my screen. And I will go through any of the questions that came in. I think it's important that we do go through them out loud as well, because some people might not have seen them within the Q&A. Gail has been very kindly. So someone asked, which I thought was quite an interesting question, do you need to be physically strong to deal with any potential violence? So I'll maybe pass that over to Kaylee and Jez, and if you could speak about maybe your experience on that.
I would say no. Obviously, you're put through a really good human training course, and you know, when we have to do physical interventions, as long as you're doing what you've been taught appropriately, I'd say no, that you don't need real brute strength at all.
And you always do it as a team. You'd never do it on your own. There's always at least a team of 3. There's always more than 3, but you have to have 3 to do any sort of physical interventions.
That's great, thank you. I think another question for Kaylee and Jez, apologies, they might be a lot directed at yourselves. But what do you think are the most important qualities for someone to excel in this role?
I think just being good with the patients and having that relationship, building relationships up with the patients. That's the main thing that, you know, as a support worker, and as a support worker, you get the time to do that. You get time to sit and spend time with the patients. What do you think, Jez?
Yeah, I'd agree with that. It's definitely about forming those relationships with the patients. Yeah.
I don't know, does anyone else have anything to add there, Gail or Jez, in terms of excelling in this particular role? No, all good. Okay, one of the other questions that came through was, is there a requirement to be able to work overnight shifts? I'll maybe pass that one to Gail.
Yes, I'm back up. Sorry, I couldn't get to you in time before, Amy. So the shifts that we have, and obviously Jez and Kaylee talked about the need to be flexible. It's one of the things, because there are shifts, one of the things that when we talked about our pre-screen interviews, if you do apply for one of our roles, it's something we will discuss with you, because obviously it's important. You're working in an inpatient environment. So our shifts include 4 weeks of earlies. And that is 7:30 to 3:30 p.m. or 7:30 to 8:30 p.m. And then you've got 2 weeks of lates, which is 12:30 p.m. until 8:30 p.m. and 8 p.m. to 8 a.m. in the following morning. And that's over a 7-day working week, and that's your standard working pattern. I'm sure Jez and Kaylee will correct me if I'm wrong on those shifts, but that's the standard pattern that we have.
Right, thanks, Gail. Some really good questions coming in, and I'll leave them open to whoever feels they kind of have the answers for it. Someone asked, if you've struggled in the past with your own mental health, would this be a barrier to gaining employment in this role?
Maybe I can. Sorry, Kaylee. Yeah, I mean, I'd say no. I mean, we do have and welcome applications from individuals who have their own lived experiences. So yes, that's absolutely no barrier whatsoever. But I'll also let Kaylee and Jez answer that as well.
We were going to say exactly the same thing, really. So
sort of wellbeing services for staff as well. So, you know, when I say about how we've been supported through DPT, there are services that you can access and use. So.
Great, thank you. Someone else asked, let's get it here now. I'm worried about forming relationships and the aftermath if this was to break down in the role. Is it quite complex? So I think what they mean there, they forming relationships with the patient and sort of the aftermath of that. Is that quite difficult?
Jez?
I don't, obviously you're going to form relationships with patients. Hopefully they don't break down, but obviously mental health, these things can happen. But you've got a good team of people around you, and no, I don't think that that's a problem as per se.
Yeah, and I think generally you find, certain people form certain relationships. Some patients you form relationships with, some people you don't, but then other staff members will form relationships with those patients. So the patients they generally have always got sort of people that they prefer to go to. And sometimes, like Jez says, the relationships do break down because they might become unwell again, and then sometimes you get those relationships back again. So it changes all the time.
And I would add to that you will learn in your role about being a professional, wouldn't you, Katie and Jez? That actually you become a professional in that role. So it's not a personal relationship, but it's about understanding the patient and what their issues are, so that you don't, and if it does trigger things for you, then you would have support on the ward and from your line managers with those kind of issues.
Yeah, that's absolutely, you're right. If you felt like you were becoming a bit too attached, with regular supervision on the wards, you could highlight any issues that you may have or may be experiencing, and that would be addressed, and you'd again have the support to do that.
Yeah, I don't know, Jez, Brian, did you want to add anything to that, just from a support perspective, because it is important to know that support is there throughout all of the trusts.
That's right, and in fact, under the new NHS initiative, we're one of the first trusts in Devon to have this new Devon staff wellbeing hub that extends beyond our trust out into other services, police and so forth, social care, and that colleagues will listen to what you're saying and absolutely fine tune the right service to meet the need that you're expressing. I've seen this working at first hand. I've had people being referred to myself. It's a really good scheme, and it's a real pleasure to feel that, as well as looking after our patients and carers, staff primarily need to be well as well. So we'll support you all the way through, whether you are encountering a problem for a first time, or whether, as someone suggested, there may be mental health occasions that you struggle with. Those can be catered for.
Amy, can I just come in on that as well, if that's okay? And following on what Jez has said, I think health and wellbeing in organisations in the NHS now has got a really high profile. It's one of our really key priorities coming forward. So I think absolutely, Jez, it's coming across all trusts now in terms of those health and wellbeing guardians, health and wellbeing hubs. There's a lot of support for our people working in our organisations. I think we absolutely have to recognise that those of you working in the organisations are actually the people that we also need to look after in a really good way. If you're not well, then you can't look after our patients. So there's a really big focus on that as part of our recovery process, making sure that you're all okay as well.
Super, thank you, everyone. Quite a few questions about coming from a different background. So someone said they have a master's in supply chain. Someone else said that they have a background in nutrition specifically. Maybe this is a question for Gail and Belinda, but they're just wondering, with that sort of background and lack of experience specifically in this role, will that hold them back? And what are the opportunities to progress?
Perhaps I'll go first, and then Belinda can talk about the opportunities to progress. I think, as Helen very beautifully put it, our process, our interview process at DPT, and this will be across other providers too. We have values at Devon Partnership Trust, and we will interview against that. So I would urge you, you've heard from Kaylee and Jez and their backgrounds. If this is, if you have a calling, if you have a desire, you want to do this really rewarding job, please apply. But really make sure, as Helen said, and I can't reiterate enough, to make sure that you when you go into NHS Jobs and you fill that application form in, read it back once you filled it in. Time and again, we see applications that just give us the bare bones, just dates, and you don't tell us about yourself. Some of the transferable skills that you can bring to us. Maybe you've done some volunteering, for example. It's all great stuff that we really want to hear from you about. So please, I'd urge you, just when you're making an application, put that down. We love to see it when we look at the applications. We have a real mixture of our from our nursing assistants at Langdon Hospital with backgrounds. They can have come from care, but equally, absolutely not. And if you're really driven and passionate about wanting to work in mental health and forensic mental health at Langdon Hospital, please do apply and put in your application. Get somebody to read it through and just press that button and apply. Belinda.
Yes, and if you're anxious about perhaps not having the skills, you would be supported, first of all, in the induction, as Gail has described, but then you would also do the care certificate, which you can Google to find out more about it. It's 15 workbooks with all the basic things that you need to know as a care worker. And you do this nationally. Everyone who goes into care does this. And it's things like awareness of mental health and other issues, safeguarding, also practical things like infection control, basic life support. So you would learn those on the ward with someone to support you. So you've got that basic underpinning knowledge. And I think if you get through the recruitment process, then you are supported to learn those skills. As Kaylee said, and Jez said, they've come from different backgrounds. We've had people moving over from admin roles into care work within the trust because they see what's going on the wards and in the teams, and they really want to be part of it. And you can also do the level 3 apprenticeship if you wanted to really feel confident in your knowledge and how you're working with people. So there are lots of support opportunities for you.
Thanks, guys. So just conscious of time, there was a few questions again about applying to certain trusts. So just to reiterate again, when you have RSVP'd for this webinar today, that specific trust will have your details and will email you their job links over the coming days. Someone else asked about their age being a barrier. I know that the NHS does not have any barrier to age, so they welcome people of all ages, so just to reiterate that. One final super quick question, because there has been a few questions about it. Again, I think it goes for Gail. A few people said they have their NVQ levels 2 and 3. Either they've done it with a trust or with someone else before, or they've self-funded. Would this be an issue joining, and does it count when they join?
That's probably Belinda.
Apologies, Belinda.
I mean, to join, it's not a problem at all. It's all good if you've got those qualifications. If you want to go on and do other apprenticeships, it really does depend what course you've done and what course you want to do, whether they're relevant. But if you've got a level 3 and you want to go on to do a degree level apprenticeship, that's going to be good because that shows you can study at that level. But there might be, we want to look at you individually to see what you've got, but it's always worth coming in and then following that career pathway once you're in.
Right, thank you. And super quick last question. What are the benefits of working for the NHS? Just a couple from anybody.
Shall I go, Amy?
Go for it.
So I think first and foremost, I just want to say thank you to all of the people that have spoken today. A real key benefit for working for the NHS is clearly, and particularly mental health, as Emma very articulately put at the top of the call, is the diversity in mental health services and the ability to work across acute hospitals, community settings, in patients' homes, etc., etc. And I think, colleagues have also highlighted as well now, the real focus on staff health and well-being, and the need to really look after our staff so that they look after our patients well as well. There's lots of focus nationally on the NHS family and people coming on board now, particularly on the back of experiences through COVID. So I think now is a really, really good time to be joining the NHS. And we focused on mental health here today. I think it's timely. It was Mental Health Awareness Week last week. So it's a really timely opportunity to be talking about this. So yeah, I think, and DPT have clearly articulated very, very eloquently their approach to this. So thank you.
Yeah, thanks, Ed. Yeah, thank you for everyone who joined today. Apologies we couldn't get through all of the questions, but some really good questions came in. As mentioned, with some of the landing pages that you've RSVP'd for, the job links will be there, so you can apply directly that way. In other cases, Trust will be sending them out to you via email, and please feel free to ask whoever contacts you some more questions. They're always there to help. No question is a silly question, so please do feel free to reach out to those people and ask anything that you might be concerned about. And yeah, thank you so much to everyone who joined today, and have a great rest of the week. Thank you.